So welcome back, everybody, and good morning, good afternoon, good evening, depending on whether you're on the western side of the Western Hemisphere, or if you are in the eastern part of the Western Hemisphere or other parts of the world. We're really glad to have you all here and excited to talk about the one of the platforms that HITLAB has been researching and testing and looking at and understanding better over the last several months. And that is a platform that focuses on, and this is an entire ecosystem that focuses on the optimization of on-call scheduling for for physicians in times of either emergency room or ICU or various other areas within a hospital and the hospital system. Particularly during emergency response, particularly now when we look at the importance of on-call scheduling and during a pandemic when physician turnover is higher than ever, physician and the great resignation is upon us, not just as a nation, but as an industry, as a healthcare ecosystem. We're seeing more issues and more things come up as physicians are managing the pandemic and now the endemic. And it's one of the harshest environments a physician with is working in a hospital or a clinic where there are constant new variants emerging, and they don't know what they're potentially going to contract and what they're potentially going to bring back to their families. So with us is the CEO and president of Call Doctor, Dr. Carl Rosen, who's also a physician and trained in New York City, now in Alaska. He's also an alum of the Columbia Business School Digital Health Program. And we also have with us Sherry Clovis, who is an executive at the Providence Healthcare System in Anchorage, Alaska. And today we're going to discuss the importance of this area called on-call schedule management, which is really a niche area in the digital health world, but it's one that's come to the attention of HITLAB because of its, number one, its near frictionless implementation, which in the world of digital health, that's almost in a lot of ways a contradiction. In a lot of ways, it's hard to actually say that in one sentence, but it's also come across in HITLAB's research as being one of the areas that have an extremely high ROI on several levels, reducing any kind of regulatory infraction and penalties financially. Number two, being able to help improve the overall physician and clinician morale by having more optimal on-call scheduling, and more optimal and more rational on-call management for that. And then number three, the revenue enhancement for the hospital system, which in today's ecosystem is absolutely critical to ensure the sustainability of so many hospitals that are under so much financial pressure. And so we'll start off the session today really getting a chance to know our two guests and hear a little bit more about their backgrounds. And Sherry, if you could, for a minute or two, give us a little bit of background on yourself professionally and what you do at Providence.
Sure. So my name's Sherry, and I have, I started out with an engineering degree years ago, and then went into healthcare. About 22 years ago. I've been a registered nurse for a long time now. One of the things that always bothered me anytime I was working on any assignment was that we tend to work harder to get a lesser result because we get busy and don't have time to invent ways to do things smarter. So fast forward many years, I've been working with the medical staff here at Providence since 2014. And EMTALA call has always been quite a bear for us. We have 1,200 providers on our medical staff, which is fairly large, especially for this area. And they're a lot of them are not employed, which is different in that it gives us less tools to manage things like the EMTALA call schedule. So when I heard of this idea at first, I was like, yeah, I'm a good workaround girl. I can MacGyver almost anything together. And so, we came up with some other ideas as well. But in the end, doing the research and figuring out, it's not just about the dollar amount. The dollar amount's very reasonable also, but it's not just about that dollar amount. It's about the investment of your personnel and the time and the return on investment that you get with the ease of use and the lack of gaps in call coverage now. And so it's just been a great product for us.
That's fantastic. And that really does give us a little bit more background on the good work that you're doing in Providence and in Alaska and Anchorage. And Carl, if you could give a similar kind of 1 or 2 minute background yourself as well, and a little bit of the what on-call scheduling is, and for folks that aren't familiar with that, and why that's important in today's ecosystem relative to what you're doing with Call Doctor.
Sure. Thank you, Stan. Thank you, Sherry. Great to be here. So I trained in New York at Albert Einstein in Montefiore. Went to school on the East Coast. Came to Alaska about 27 years ago. I'm an oculoplastic surgeon, and really the only oculoplastic surgeon in Alaska. So I saw the need to connect myself with the patients who were in the emergency room, on the patient floor, for nurses, doctors, just to communicate better with my colleagues for more effective patient care. And we decided to leverage EMTALA, which is the Emergency Medical Treatment and Labor Act of 1986, that says that any patient who presents to the emergency room has to be triaged, regardless of their ability to pay. And using this as the foundation, we built Call Doctor. We just really tried to make it more efficient and to improve hospital stakeholder communication and then sharing the schedule and networking it externally with other hospitals in the region or in the state. And we found it to be very effective. Brilliant.
And so tell us a little bit more, Carl, about, from your perspective, how the on-call management ecosystem is so important to a hospital system in the pandemic and what we're facing today.
Well, sure. So, particularly, given this difficult time where resources are strained, I mean, they're strained just as a baseline, but more strained given the pandemic and what it means to the community. But just essentially organizes the schedule and the 100 or so specialists more easily, so that people like Sherry, who do great work, have to really invest less time in managing this complicated process. We make it easy for you, we make it efficient, and when people know what they have to do and that it is digitally accessible on their smartphone or on the PC, people are just more polite. People just do their job better, and they don't fight. They don't say, I'm working harder than my, the group next door, et cetera. And as a result, you take that part of the element out of the equation, and the system just runs more efficiently.
Agreed on that one. I think that's one of the things that HITLAB found in its research and just interviewing people across the country around this ecosystem of on-call management. Again, not only relative to reducing fines upwards of about $100,000 if someone isn't treated within a certain time prescribed therapeutic area, but also just being able to improve physician clinician morale by having coverage. So someone isn't working extra shifts and on top of having worked an overnight shift, having to work even more than that. And then finally, revenue generation. And that's really on top of that, this idea of a very light implementation. In digital health generally underscores and there's an insinuation because healthcare data and healthcare systems are so integrated, require multiple APIs, require 10 different departments to work together with 3 different vendors, et cetera. Sherry, talk a little bit about that, because HITLAB's research really found that the implementation of a system in several hours is almost unheard of, and being able to do it without a lot of rigmarole and trainings and that sort of thing because it's so intuitive. Tell us a little bit about that, Sherry, and the experience on the implementation side of this.
Yeah, it was quite an evolution for us because we had been stuck in a paper system to where we had a 5-inch thick binder that had basically had one person having to maintain that on a consistent basis. And if you can imagine 1,000 providers being maintained on a daily basis by one human, there was a very huge margin for error. It was not a good source of truth as it could have been. And I want to add to your statement about it eases the way for providers, and it eases the way for anyone working in the hospital who has to at any point try and figure out who's working for a certain service. It eases the way also for those outside of our facility. Right now, I believe in our state, we have, I think, 23 different locations are able to sign on and see our on-call provider so that they know who they'll be contacting when they need a differing opinion or an expert service. So that alone has knocked out what could have been 10 different phone calls to find one name. We were finding those phone calls, unfortunately, were coming into our ER clerical desk, and sometimes as many as 800 phone calls per day coming in from outlying facilities, clinics, et cetera, asking the ER administrator, who's on call for this? Well, that person has another job aside from answering that phone and answering those calls. And so when we did the calculations, it's like when you add that up over a year, it's very difficult to look at a dollar amount, but just the savings in personnel use in that is incredible. We've estimated probably greater than $1 million, at least 5 full-time FTEs. So all of that has come from the 5-inch binder to our last ditch effort was after we first heard of Call Doctor. We don't make change easily in healthcare sometimes, and so we tried to devise something on our own. And we're pretty educated people using existing tools available on the web and stuff. Still very, very labor intensive, just wrought with errors, super difficult to maintain. And once we started to really dig into the Call Doctor, the excitement was just like, wow, why did we not do this years ago? Because it is just so incredibly easy to use, and it puts the onus back on the physicians and their clinic staff who know their schedules and who know how they want to best be contacted, et cetera. So it takes that all out of our hands. As you can see in my title, the word regulatory is there. And so when it comes to EMTALA violations, the buck stops with me. And so this was just a really great product for us to find. We're super happy to be using it.
And talk a little bit about the implementation. I know that's something in our research that came up. How long did it take to actually implement the Call Doctor system?
It took us probably 4 months to get everything shored up, but that was because we were going against a very resistant to change group. So our physicians liked things the way they liked them, had no idea what was going on in the background to try and maintain what was happening. So we tried to be very gentle and slow moving and informative, very transparent with them. Sam, our liaison with iDimension, who has assisted us with the implementation, came in, he visited each office, he did all the training. So that piece was taken completely out of our hands. I think the early adopters were just blown away right away. And then of course the stragglers are, oh, I don't need this, and they know how to find me when I'm on call. We implemented October 5th of, I want to say 2018 at this.
That's right.
Been several years, yeah. And it was funny because they were like, well, but we might need this before we start. And I'm like, no, flip the switch. We're flipping the switch. The switch got flipped, and very few complaints. And those complaints were based on lack of education. And it's just been a great tool for us. Now we have schedules done. Dr. Rosen reminded me the ophthalmology schedule for the next year is already populated. And I know some of our surgical schedules are populated for at least 6 months. And the really cool thing is to change that. Before, it would have been a physician telling his office staff to call our office staff to make the change. And then our office staff would have to call the physician that he wanted to change with and talk to their office staff, who would talk to that physician, who would come back there. And I mean, it sounds ridiculous, but it was all that work just to verify that one change was getting made. And now it's a couple buttons that they push on their iPhone and it's done.
It's amazing. Now, it really does sound in so many different ways like the a digital health solution that is almost like a dream solution for so many different folks. So overall, Sherry, did it take about 10 hours, 20 hours, 30 hours to implement? About how many hours did it take to actually do the implementation?
It's so seamless that I couldn't really tell you. And I got a little picky with what I wanted displayed, because I wanted to do it right the first time. And so the engineer would work on it and he would bring it back and say, okay, here's this. But truly, I can't say that it would have taken any longer than 20 hours total. Most of what we did was educational. Actually building the platform, it was there, and it just needed the plugins to get it to go. I get excited. So part of my background is in disaster management, and I'm obviously living in this state of Alaska. It's a good set of skills to have. And just with the pandemic, where you're always glad to be prepared and not use something that would mean that your conditions were pretty bad. But we were super stoked with some of the emergency preparedness work that we were doing with the Call Doctor platform. It was definitely a tool that was a very reassuring in a rough time that we could handle whatever was coming. And I can tell you more about that if you want, but I don't want to take up all your time.
No, it's great. So it sounds like the implementation took less than like 20 hours total and a month total. Is that about right?
Oh yeah. And it could have gone faster. Like I said, we crept along because, we wanted to baby step it. I think it could have been much faster, but by Call Doctor standards, but we were as the customer, we were wanting to go slower.
Totally get it. And so, Carl, from your perspective, Carl, when you are as a physician and you're covering, what are some of the issues that you've seen that this has resolved? What's the value creation that pre Call Doctor, post Call Doctor at the within the Providence ER in Anchorage?
Right. Well, I think first and foremost, the response times are just quicker. Your ability to communicate is more effective. So if there's a patient in Fairbanks or Juneau or Southeast, I can get that information, in minutes rather than waiting hours. Or if I get a picture through the system, for me, it's a CAT scan of the face, an orbital fracture, a facial fracture. I mean, I know exactly what's going on and how I need to proceed. So I can call the operating room. And so we don't have to, delay patient care. We can reduce that morbidity. And that just means, better patient experience. So essentially what it's done is it's taken a process and it's updated it and just made it better. I mean, simple as that. It's instead of this long, it's this long. And, that was our intention when we designed the product. And I talked to a bunch of docs, and, that's how we built this. And, it really, it's proven itself. And so, I think we've made medicine better in Alaska.
That's great. Love that. Love the ring of that for sure. And Sherry, along those lines, everyone likes metrics. I'm sure the CFO at within the Providence Health System, Alaska, likes metrics as well. And it seems like there's a few different metrics here, and HITLAB's research really did hone in on this. First things first, from a regulatory standpoint, kind of let's say the 3 years with Call Doctor versus the 3 years before Call Doctor, what were some of the regulatory financial burdens that you were seeing that when you didn't have Call Doctor that now you just don't see anymore, in terms of, things like the fines and whatnot?
Yeah, the EMTALA fines are virtually non-existent now, in regards to those that occur because of lack of being able to find the physician. I think the response time has been cut down. And, you don't place a dollar amount on when that patient's sitting there waiting for that needed service, but there is one. And there's also, a personal bill that's racking up as you sit there and you're in pain and you're not feeling well. So it's interesting to try. We are working to try and quantify more metrics like that. Part of my team is our quality and analytics, and they are working to try and see how we can better quantify what value we are receiving from Call Doctor. We do also, it's not like an official metric that we follow, but I don't know if Dr. Rosen realizes that we've been able to use this platform very well to communicate during the pandemic, because, as you know, when things first started and the news is blowing up and all the social media is blowing up and the Providence emails are blowing up, whether they're a valid source of information or not, and we were able to absolutely use Call Doctor platform as the source of truth coming from our chief medical officer and our chief of staff, because we locked it down tight and could send I can send emergency text messages within seconds to all 1,200 registered users of Call Doctor, or an email. So what we would do is to provide the valuable information as to what physician coverage do we need today, or extra of this. We would use that Call Doctor platform to send the text out, and our physicians got to trust that I know this is coming from our chief medical officer. I know that this is valid information. So it was great that they didn't have to weed through it. They knew if the text came from Call Doctor, because we don't use it just to send, hey, there's pizza in the break room. They knew it was an important message. So that was great to have that really valid way of communicating with them. And it also allowed us, and this is another thing that I would love to somehow figure out how much money this would save. I'm thinking probably in the millions, honestly. When the pandemic started, we weren't necessarily short on doctors up here. We were short on a few specialists type of doctors, but what we were short on was just caregivers on the whole. And Call Doctor platform was able to build us I want to say they built us another facility within their platform. So they took our information and cloned it. So instead of Providence, it was called our alternative care site, because we opened one of our big sports arenas with help from the municipality and the state and the other facilities in the area. And we were able to build that out. I say we, Call Doctor was able to build that out as an actual freestanding facility, so that we could use the QR code. And so let's say, for example, you're an ER doctor now, but you started out as a registered nurse. And we do have those people here. And so we were able to have people say, here's what I do now. Here's a skill set that if I brushed up on, I could assist. Here's when I'm available. Yes, I'll go to the front lines, or no, I need to stay in the background. It was a wonderful way to collect information. I mean, we were ready to go. If we would have pushed the button and opened that site, we literally could have had that call schedule populated just like with the blink of an eye, honestly. And it was so impressive to me. I don't think we did work some with the state, and they had a call roster that they maintained, one man maintained on a daily basis. So that to us was scary, and we're like, oh, you gotta let us help you with this. So fortunately, it didn't get there, but buddy, we're ready for next time.
Well, that's amazing. And I think, when we hear about all the different value that's been attributed to this new type of digital health platform and this intelligent on-call optimization solution that folks around the country are really gravitating towards. Let's talk a little bit about, it sounds like the EMTALA fines went from, let's say, $1 million over 3 years to 0 over the 3 years after. Is that right?
I can't tell you the exact amount, but we had several prior to this. And EMTALA fines work in two ways. So it's sometimes the EMTALA fine is on the us as a facility, and sometimes it's us pointing to another facility, in that they sent us someone without doing a triage or whatever. And so I don't have a clear line of sight as to those type of fines that occurred, but we don't see that happening anymore, in that we're getting patients sent without any type of a triage. It just doesn't seem to happen anymore because they come in and we know exactly who to call to get to them.
Okay, that's brilliant. And that really does help a lot, I think, in terms of understanding so obviously, something in the 6-figure range, probably high 6-figure range, 3 years pre-call doctor, 3 years post-call doctor, those are gone. And that's an amazing story right there. But I think, and we'll start you with Carl, on the physician burnout side, because that's one of the things that we're seeing across the world, especially in the US, and most recently, especially in Alaska, is the stress this places on clinicians and first responders, the pandemic, the ability to catch a bug at any wrong time or whatever. And now, with variants coming down the pipeline, Carl, having this available, from your standpoint, what have physicians said to you? What are some of the anecdotes that you've taken away by having, physicians being able to use this kind of intelligent on-call scheduling solution so that they're not working, 30-hour shifts or even 15-hour shifts. Now they're working more rational 8-hour shifts because, like Sherry said earlier, they're scheduling 6 or 12 months ahead of time, which sounds like it's previously unheard of. How has it affected your life, and how has it affected folks in Alaska who you're working with on the front lines there?
Right. So when you deconstruct it, it basically does a couple things. One is it simplifies a potentially complex process. So that's lovely. And so that reduces, the time it takes to do your patient care. And so if it makes it more efficient, your life is easier. You have less to worry about. There's less burdens, there's less stress. And that all goes a long way in the aggregate when you really compress all the things that you have to do. And, again, it's a simpler process, but it really, it affects your entire, existence. It affects your day-to-day work life. It affects the way you communicate with your colleagues, with your partners, with the hospital, with other hospitals, and ultimately with the patient. And again, the patient experience is just so much better. And so when the patient is happy, the doctor is happy, the nurse is happy, everybody enjoys their day-to-day work life better. It's not a grumpy atmosphere. It's a happier, more cohesive atmosphere. With the tool, it's essentially just an updated version of what we do day to day, but again, more effective communication.
Yeah, and no one wants to see a grumpy doctor, right? I mean, that's not a good thing at all.
You don't want me as a grumpy doctor, no.
Definitely not you. And so, Sherry, along those lines, anecdotes that you've seen from physicians or even, folks on the administration side who are just, less stressed around the scheduling process and the
Yeah.
conflicts that physicians see. What have you seen from your physicians? What have they told you, or what have you seen in terms of, things like just overall morale, because the scheduling systems are worked out 6 to 12 months ahead of time now?
I think that they are incredibly happy that the source of truth is way more valid now, in that when they're on call, and nobody accidentally calls them when they're not on call. Because that for years, because I worked in the ER for years in the night shift. And so we're the ones calling and picking up these physicians in the middle of the night. And countless times, I'm not on call, Dr. such and such is on call, we made the switch. Well, you kind of did, but you didn't really. And now that onus of that process is on that physician. And so we very rarely see somebody that shows up as being on call that is not on call. And so I think just having them own that process, it's a huge satisfier for them because they're not getting the calls. It's a huge satisfier for nursing staff trying to make the calls, because we don't want to be the ones calling the wrong person, and we just need the help when we need it now. So anecdotally, I think that has been an incredible satisfier all across the board, to actually know who's on call and have that be such a valid source of truth.
Okay, I think that's absolutely what we're seeing here. And then in terms of revenue generation, or maybe new lines of revenue that you hadn't expected to see before, and now because of Call Doctor and then this kind of intelligent on-call scheduling optimization solution, what are you seeing now in terms of revenues, and how this has helped generate new lines of revenue that didn't exist 3 years prior to Call Doctor coming into the picture?
Yeah, what we're looking at right now, just met about it the other day actually, is as the climate changes in our healthcare community here in Alaska, in recent times, some of the specialties offered at one of the other larger facilities in the area has really changed, and caused us to really reevaluate what we need to do better to better serve our community in the absence of someone else being able to do that. So with the Call Doctor, it gives us the platform to be able to build that in there and let the 23 different facilities. I mean, some of those facilities are out in very villages, and it gives us the capacity to let them know that, hey, we do have this service here. All you have to do is pick up the phone or whatever and call. So it's really good as far as allowing us to communicate well. Working with we have a very robust transfer system that's being put into place now. I believe it's been about a year now that they've been up and operating. And so working with them to better assist in transfers in and out. Some of that work started this past summer when our COVID numbers went down and we could actually breathe a little bit, and then they kind of surged again. But definitely think that in the new year, we'll be working better to see how Call Doctor can help us assist in making sure that we're always connecting the right physician with the right person here at the hospital to get the patient placed.
It's incredible. And so would you say revenues have been tracked around Call Doctor, or how has the revenue situation improved with Call Doctor? How have you seen new revenues coming in because of on-call optimization?
Yeah, I hate to keep using this as an excuse, but our standard work was annihilated by the pandemic. So projects that we had started looking at valuation and metrics regarding Call Doctor just pretty much went by the wayside as we all wore many hats to take on the responsibility for caring for the community and the patients. And so we're just now getting back to where I consider us on stable enough ground from my perspective. And that doesn't mean, I'm not a frontline caregiver, so I'm not speaking for their ground being stable, but stable enough to let us be more creative and then deep dive and see, how did it help? So we're doing more retrospective reviews. And we are finding things that we didn't think would happen. I mean, Sam from iDimension runs reports for us. It's pretty amazing how many people access our Call Doctor schedule per any given day. And I would love to dig further into that and say, okay, what were you looking for? Because I know he has the capability of doing it. I just haven't had the time to sit down with him to say, here's what we want to look at. So I think there's a whole lot of potential there.
And roughly, how many people do you see accessing the system a day? How many engaged users are you seeing access the platform?
Hundreds. I'm not sure. I know we have I believe 400 and 500 per day. Sometimes I don't monitor it on a regular basis, and I do have the numbers written down, but it would be interesting to see. So there are many ways that we can look at the value of that by breaking down to see, okay, so were those accesses coming from within our facility, from within another facility, from a clinic access, or, and so then we could kind of target and say, okay, what were you looking for? Did you find it? And what value was that to you? To help us put some dollar value. I think honestly, it's just probably in the long run in the millions of dollars. If there was a way to put a quantifying factor into even just the personnel piece has been tremendous.
So millions of dollars in terms of new revenue, or in terms of personnel savings, or each
Well,
side?
I mean, each size. I think right now what I see the most of is the personnel piece, because they don't let me play with the money as far as revenue goes. That's just not part of my job. And because my department itself is not a revenue generating, the way I look at money is a little differently than someone who's actually billing and building a revenue source. So but I think it's the potential is just incredible.
Well, there you go. It's now, again, one of my lectures at Columbia is about how digital health can be a revenue generator. So now you might have to look at your department being a revenue generator because of Call Doctor generating revenue from optimizing on-call scheduling. Yeah. Well, again, really appreciate your time, Sherry and Dr. Rosen, both of you, for joining us in this truly incredible story about Call Doctor, a 10 to 20 hour implementation that then generates revenues, saves times, and it saves personnel time, saves regulatory fines, and improves this whole issue around physician wellness and physician longevity within their ecosystems. So, congratulations to you both. Number one, obviously Dr. Rosen for inventing this platform, and Sherry, number two, taking the risk in implementing this. Obviously, in these days and times, everyone's worried about deploying new technologies, and obviously this one was a gamble you made, and it paid off in spades. So, congratulations to you as well for being that pioneer.
Thank you. I'm excited for what's to come. I think that we're only using a tiny bit of the capability of the platform.
Fantastic. Well, thank you both. And to the audience, we're going to take about a 20-minute break. We'll be back at 1 p.m. Eastern. If you could tune back in, we're going to be talking with Anita Rayat from Novartis, and who heads up a lot of their business development and licensing activities in digital health, and hearing her perspectives and some of her tips and hints on how digital health companies can work better with life science companies and licensing, and how life science companies should be working with digital health companies to find the next great solution. Thank you, everyone. Have a great morning, afternoon, evening, wherever you are. Talk to you soon.